This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hi, everybody. Dr. Ben Weitz here, and I'm here with my friend, cardiologist, Dr. Howard Elkin. Hi, Howard. Thanks for joining me today.
Thanks. It's a pleasure to be here.
So I'm very excited to announce to all my patients that Dr. Elkin will be joining our practice on Tuesdays, starting February 6th. And Dr. Elkin is an integrative cardiologist, and he will be launching a concierge cardiology practice on the west side of LA out of our office. So anybody who has need of a cardiologist, please call our front desk and we can get you an appointment right away. Dr. Elkin, you're known as the medical advocate. How did you get that name? What exactly does that mean?
Well, I got that name because I've actually been a patient twice during a span of 19 months. I was at Cedars-Sinai for two separate medical conditions emergently from a 19-month span. And I learned by being a patient, I saw the pitfalls of the medical system. And I learned from the very onset what I had to do to stay on top of my health. You know, I had the traditional care from the doctors, the nurses, which was great, but it wasn't enough to keep me going. So I learned firsthand how it was to be a patient. So then I was working on my image, and my coach said, you know, you're a medical advocate. So I thought, well, you know, I'm a medical advocate because I walk the talk, but what I really want is for my patients, my readers, you know, people that I present to become their own medical advocate. You don't have to have a medical degree. It's about stepping up to the plate and taking charge of your health. That's what a medical advocate does. So I am the medical advocate, but I want everyone out there to be their own medical advocate.
Yeah, I think that's important. And becoming a patient sometimes does give you insights. I remember that doctor movie with William Hurt, and he turned to all the residents and he said, okay, now you're going to get a colonoscopy, you're going to get this procedure done. And he gave them patients' gowns, and they were aghast. And it sure turned their heads around when they saw what it's like to be a patient and to be in some of these situations.
It's pretty scary.
Yeah. So you're an integrative cardiologist. What does that mean? You're a heart doctor, right? What are you integrating?
Well, integrative cardiology is in functional medicine, the terms that we use a lot these days. So integrative means, yeah, I am traditionally trained, like most cardiologists, but I also think outside the box, which is, I feel very important. I believe is very important. So in other words, I don't just, okay, high cholesterol, you get a statin. High blood pressure, you put on this medication, and you have to get a level of, you know, less than 130/80, or we just have to add another medication. So what I try to do is to look at things other than just medication. I look at diet. I look at exercise, stress management. So I integrate those other modalities into a person's, into what we're dealing with medically. So it's really a combination of different things. So I don't rush to medications. And certainly I use medications. I'm a cardiologist and I deal with a lot of ill patients, but it's really integrating traditional with, I don't like the word alternative, but it's whatever works for the wellness of a patient. So, and it's thinking about the cause. You know, in medicine, we are so consumed with fixing things, and we don't really have time. You know, medical school, you aren't taught to really be an independent thinker. So an integrative cardiologist, you have to think. You cannot put all your patients in one mold, one box. So, it's a different way of thinking, and I've kind of always been this way. But through my years of practice, this is what's made me different than my peers, is that I integrate different modalities, all for the wellness of the patient.
Some patients are used to maybe they've been dealing with high cholesterol or high blood pressure, and typically they go to their primary care doctor, they go to their cardiologist. Once this comes up, the answer is here's a statin, here's blood pressure medication. That doesn't work. Let's add a second medication, and that's about it. And the assumption is that this is genetic, and that's it. So, but that's not really the best way to handle these things, right?
Absolutely. I'm telling people, and I've written about this, when I say, okay, well, your cholesterol is really high. And when I just give them a drug from the onset, or say, okay, come back in 3 months, is that better? We're going to give you a drug. I'm telling you that I know you can't do this on your own. So let's just go do drugs right now. And so what we're doing, by doing that, we are disempowering patients. So my whole thing as an integrative cardiologist is to empower my patients so that they can do this on their own. And
so you're saying they can lower their cardiovascular risk factors with lifestyle, diet, exercise, right?
And supplementation. Absolutely.
Right.
Absolutely. I've seen it all the time. It's like, when we cite studies like, okay, this study shows that low in cholesterol does this or that, that's based on the average person. See, my patients, we don't want to be average. We want to be better than average, and that has to do with lifestyle. So the studies are very skewed because you're usually dealing with a set population. So I don't know. You can do a lot with lifestyle. I've seen it from 30 years that I've been in practice.
And it's my understanding as a functional medicine practitioner that the reason why the body ends up producing, most of the cholesterol is produced by the liver. It's not ingested. And the reason why the body produces cholesterol is it actually has a beneficial purpose. If there's inflammation in the arteries, the cholesterol actually ends up coating the arteries. So it's a way of protecting the body. So, the body's not just haphazardly creating damage that's going to end up killing you. So you really want to figure out, why is the body coating the arteries? What's creating this inflammation? And let's try to get to the root cause, right?
Absolutely. I mean, you said a mouthful, because cholesterol is essential to life. Without cholesterol, we wouldn't have sex hormones, we wouldn't have bile acids, we wouldn't have myelin sheaths, we wouldn't. It's so important for brain function, for overall function. So, like you say, about 75% of the cholesterol in our bodies is actually produced by the liver. So even if you have a completely plant-based diet, you're still going to produce cholesterol because it is essential for life. And about 25% is absorbed by the GI tract. So, yeah, the whole key is inflammation. We know, not just with heart disease, with cancer, autoimmune disorders, and Alzheimer's, all these diseases of aging have one thing in common: inflammation. And when I was a fellow in cardiology, we didn't know about inflammation. We've evolved, and we know so much now. So now we have to figure out how we can combat inflammation instead of just lowering cholesterol. Yesterday, a patient came to see me who, for the first time, he was on a high dose statin. His total cholesterol was like 115, which I think is really low. His LDL was 30s and 40s, something like that. And it's too low. I worry about people being on too much statins for too long when it comes to brain function. I mean, how good is a great heart if you don't have a great brain to match it?
And no libido on top of it.
Absolutely. And vitamin D. I left that one out. So all these are important. So cholesterol is essential for life. It's figuring out the link between cholesterol, meaning the lousy cholesterol, and inflammation. And that, of course, is what leads to plaque in the arteries.
So you mentioned a plant-based diet. There's a lot of confusion about what's the best type of diet for your heart. The American Heart Association is still promoting this low-fat diet concept, and they recently, within the last year, put out a statement saying that saturated fat was indeed the cause of heart disease, and that you shouldn't consume coconut oil because it's mostly saturated fat. And this view was also promoted in a very popular documentary called What the Health, that many people saw. And I know we got lots of questions in the office. I had patients calling me up frantic. Oh my God, Dr. Weitz, you told me it was okay to eat coconut oil. Oh, it has saturated fat. Oh my God, is this going to kill me?
You know, this is one of my favorite topics because I actually wrote a blog a few months ago, but talking about the American Heart Association when they came out with that new statement in June about saturated fat is bad for you, which includes coconut oil, and also about the what the hell. So my blog was entitled "What the Fuss," because first of all, if you look at the movie, which was well produced, there was a lot of I would call false facts. With a lot of the statements that were stated were simply not backed by science. I mean, when you hear that eating eggs is as bad as smoking, I mean, really? That's what they actually cited, what they said in that particular movie. As far as the Heart Association is concerned, you and I have talked about this at great lengths. It was based on, I think, 2 or 3 studies from the 60s. And I would like to think that in 50 years, we've come a little bit further. But since that particular statement in June, I think the Pure study came out in September, if I'm not mistaken, and it said that people eating a high-fat diet tend to have less mortality of all cause. So there is not one diet for all people, and I think you and I both agree on that. And people say, what is the ideal diet? It really depends on what your goals are. But I think the old thing about the low-fat, high-carb diet from the 90s, which is, the Dean Ornish diet and that was the big diet then. Well, what happened in the last 20 years, we have more obesity than ever before, and diabetes has become an epidemic in this country. So that diet has clearly failed.
And, it turns out that a closer analysis of some of those studies in the 60s that the American Heart Association was basing most of their recommendations on, even though there was a statistically decreased risk of people dying from heart disease, there was no statistical decreased risk of dying completely, because to compensate for the fact that there were less people dying from heart disease, more people were dying from cancer, probably from eating all these carbs and these oils that become oxidized and cause damage in the body.
Right. Absolutely. And now we talk about that, I think what also really hit home was that during with that statement published by the Heart Association back in June, they said all saturated fat is bad for you, including coconut oil, which we know is absolutely true, and that we should be eating. Well, they did say olive oil was good, which I can attest it's very heart healthy, but they also grouped in canola oil. Now, I don't know anyone that's ever watched videos on how canola oil is produced. It's very, very industrial, and I would never recommend it. And they also said, well, we should be eating canola oil, olive oil, and also vegetable oils.
Right. They specifically recommended soybean and, these other vegetable oils that we know are high in omega-6s, which lead to more inflammation. And, we've just been talking about what a role inflammation plays in heart disease.
Absolutely. There's a test that I do, one of my specialized tests that I do, and it gives you an omega-6 and omega-3 index, breaks it down to the various fish omega-3 fatty acids, also the monounsaturated fat index, some really useful stuff. But it also gives the saturated fat index. And I tell patients, don't even look at that because it's controversial. Where should you be with saturated fat? I, for one, don't believe we don't have to eat saturated fat. We can't. So, and I think more and more good things are coming out about it. Like it may increase your LDL, but it may also increase the size of your LDL, which is actually a very useful thing.
Yeah. So I think the bottom line is for doctors like yourself and myself, we want to test our patients. We want to do an advanced lipid profile. And if we recommend a diet, we're going to be testing them and see if that works for them. And it is the case that people do respond differently to different diets. And, rather than take an absolute position, everybody has to be on a plant-based diet. The best thing to do, and I think you agree, is to test your patients, see how they've been responding to the diet they're on, make recommendations, and then test them again and see if that's working for them.
Absolutely. And, that to me is the fun of what I do in functional medicine, integrative cardiology. And we'll get to the fat page and I'll say, this is my fun part. But this tells me how your diet's affecting your blood levels. And when you explain it to them, which they don't get when they go to the traditional cardiologist's office, they get it. They embrace it. And a lot of them are really willing to make change. And that's the fun of what I do and what you do. But it is taking the time, you can't just say your cholesterol is high and you should be on a drug, because we're just telling them that you can't do this on your own. So we're going to give you a medication, which we know has side effects. I don't care what they say. I mean, statins are very useful in a subset of people, and I do use them. But, the side effect rate is not insignificant.
Right. And, that's one of the advantages of coming to see an integrative cardiologist like yourself, is that you're going to schedule enough time to be able to carefully go through their history, explain their test results to them, and make specific recommendations that go beyond simply writing a prescription.
Absolutely. I mean, same as you, as functional medicine providers, we're going to ask about sleep. We're going to ask about libido. We're going to ask about hormones. There's so many things to encompass a person's state of wellness. So that to me is essential. And you need to have time to do that. You can't do that in a quick session.
Right.
It's building relationships with your patients.
Right. I think, unfortunately, the average medical doctor is limited to something like 7.5 minutes, mostly just because of insurance reimbursement.
They say 6 to 8 minutes. If you're going greater than 8 minutes, you aren't being effective. Can you imagine that?
Well, unfortunately, that's, so many things are dictated by the insurance companies, and, their reimbursement scale requires that, unfortunately.
Right. Absolutely. So,
Yeah. So I just wanted to mention also, and you might want to say a word about that, which is that apart from being a cardiologist, you're also an anti-aging specialist. And so you work with patients who are, trying to, work against the aging process and feel youthful and vigorous and have great brain health, even into their later ages. Maybe you could talk a few minutes about, how that's part of your practice.
Well, one of the things, of course, is the whole thing about hormones. So first of all, there is no fountain of youth. Okay, I think we agree on that. But hormones do play a role, and I don't think they're for everyone. But I get so many complaints, so many questions about well-being. A lot of it is hormonal, a lot of it is lifestyle, a lot of it is a lack of nutrition. So we do things like intracellular nutrient testing, which you do, that tells us what's happening at the tissue level. Of course, we test for hormones, and a lot of adrenal dysfunction. I got testing adrenals for about 8 or 9 years now, and I found out that almost everybody has some degree of adrenal dysfunction, some worse than others. So it's really important to piece all that out, because that's part of their wellness. We're doing functional medicine or integrative cardiology, the two, which it's all putting things together. It's putting the pieces of the puzzle together. So yeah, I started doing longevity medicine in 2000. I've been in cardiology in my private practice since 1986. You believe it? And then I liked the anti-aging part, so I said, maybe I should get board certified. Then I did the written boards and the oral boards. Maybe I should do the fellowships. I did it in reverse order. But I love it because I'm always learning something new. And I think the strength in this kind of medicine is that you'll never know it all as practitioners, but every day we learn something new. And that's what brings me, forward. I love what I do as a result.
Great, Howard. I'm excited about you joining our office, and I'll be seeing you on February 6th.
You got it. All right. Thanks so much. Appreciate it, Ben.